Systemic lupus erythematosus, SLE, commonly referred to as lupus, is a complex autoimmune disease that affects multiple organ systems. With a prevalence of approximately 20 to 150 cases per 100,000 individuals worldwide, SLE predominantly affects women, especially those in their reproductive years. SLE is characterized by the production of autoantibodies against self-antigens, resulting in chronic inflammation and tissue damage. SLE is considered a multifactorial disease with a complex interplay between genetic and environmental factors. Genetic studies have identified various susceptibility genes involved in immune regulation and immune cell signaling pathways. Dysregulation of T and B lymphocytes, dendritic cells, and macrophages contribute to the pathogenesis of SLE. Furthermore, environmental triggers such as ultraviolet, UV, radiation, infections, and certain medications can initiate or exacerbate SLE in susceptible individuals. Systemic lupus erythematosus, SLE, can present with fatigue, weight loss, and joint pain. Skin problems, kidney damage, and blood abnormalities are common. Cognitive dysfunction and mood disorders may also occur. The diagnosis of SLE relies on a combination of clinical features and laboratory findings. The ACR has developed classification criteria for SLE, requiring the presence of 4 out of a possible 11 criteria. These criteria encompass a wide range of manifestations, including cutaneous, musculoskeletal, renal, hematological, and immunological involvement. The detection of autoantibodies, particularly antinuclear antibodies, ANA, is a hallmark of SLE. Additional specific autoantibodies, such as anti-double-stranded DNA, anti-dsDNA, and anti-Smith antibodies, can provide further diagnostic specificity. In SLE, monitoring disease activity is important. Different tools like SLEDAI, BILAG, and SLAM are used to assess severity and activity. These help in managing and treating the disease and predicting prognosis. Lupus nephritis is a common manifestation of SLE, affecting approximately 40 to 75% of patients. The pathogenesis involves immune complex deposition in the glomerular basement membrane, leading to inflammation and subsequent renal damage. Clinical features range from asymptomatic proteinuria to severe nephrotic syndrome or rapidly progressive glomerulonephritis. Early diagnosis and aggressive treatment are essential to preserve renal function and prevent complications. Immunosuppressive agents, including corticosteroids and cytotoxic agents, form the cornerstone of therapy for lupus nephritis. The dysregulation of the immune system in SLE involves both innate and adaptive immunity. B and T lymphocytes play a crucial role in the production of autoantibodies, contributing to the chronic inflammatory state. Various autoantibodies, including anti-dsDNA antibodies, anti-Smith antibodies, and APL, are highly specific for SLE and are used in diagnosis and assessing disease activity. Additionally, the presence of APL is associated with an increased risk of developing thrombotic complications, such as venous and arterial thrombosis. The management of SLE requires a multifaceted approach, tailored to the individual patient's disease severity and organ involvement. Non-pharmacological interventions, such as sun protection, exercise, and lifestyle modifications, form an integral part of SLE management. Immunosuppressive agents, including methotrexate, azathioprine, mycophenolate mofetil, and cyclophosphamide, are employed to control disease activity. Corticosteroids are commonly used for their potent anti-inflammatory effects, but long-term use is associated with significant side effects. Biologic agents, such as belimumab, targeting specific immune pathways, offer a promising treatment option for refractory disease. Pregnancy in SLE patients requires careful planning and close monitoring due to the potential risks associated with the disease and its treatment. Active disease and certain medications may increase the risk of adverse pregnancy outcomes, such as preterm birth, preeclampsia, and fetal growth restriction. A multidisciplinary approach involving rheumatologists, obstetricians, and maternal fetal medicine specialists is essential to optimize outcomes. Medication adjustments, regular monitoring, and proactive management of potential complications are key strategies in the management of SLE during pregnancy. SLE is associated with an increased risk of various comorbidities and complications. Cardiovascular disease, including accelerated atherosclerosis, is a leading cause of mortality in SLE. Infections, particularly opportunistic infections, are another significant concern due to immune dysregulation and immunosuppressive therapies. Osteoporosis and fractures are prevalent in SLE, requiring early detection and preventive measures. Furthermore, SLE patients have an increased risk of developing malignancies, such as lymphoma. Vaccination, smoking cessation, cardiovascular risk factor modification, and appropriate screening measures are crucial in the management of these comorbidities. Lupus flares are episodes of increased disease activity and worsening symptoms. Various factors can trigger flares, including infections, medication non-adherence, hormonal changes, and stress. Preventive measures involve patient education regarding trigger avoidance, regular follow-up, and medication adherence. Cumulative organ damage is an important consideration in SLE, as it can lead to irreversible complications and decreased quality of life. Monitoring disease activity, optimizing treatment, and addressing modifiable risk factors aim to minimize organ damage and enhance long-term outcomes. Research in SLE is revealing new knowledge about the disease and potential treatments. New targeted therapies are being studied to control the disease better and with fewer side effects. Improved diagnostic tools and disease-modifying drugs are also being investigated, offering hope for better outcomes. The complexity and multisystem nature of SLE necessitate a multidisciplinary approach to care. Collaborative efforts among various specialists, including rheumatologists, nephrologists, dermatologists, neurologists, and others, ensure comprehensive management and coordination of care. This approach facilitates early diagnosis, timely intervention, and optimized treatment strategies. Additionally, addressing psychosocial and emotional needs through patient support groups and mental health professionals can greatly enhance the quality of life for SLE patients. The exploration of SLE topics helps students understand how the disease develops, presents, and is managed. Students will be able to diagnose, assess, and treat patients confidently, emphasizing multidisciplinary care. Regular updates and research are crucial for excellent patient care.